Together, we are making progress against COVID-19 and getting our active lives and economy going again. As businesses unlock their doors and restock their shelves, you remain safer at home. But if you must go out, use the government's guidelines to stay safe. Wear your face covering when entering a business. No face covering, no service. Use hand sanitizer before entering and when leaving a business. And stay at least 6 feet apart. Practice social distancing. Safer at Home USVI is step 3 in our path to a new normal. We're depending on you to do your part. For more information, visit www.vi.gov.
The Virgin Islands Energy Office encourages all residents to continue to follow the recommendations of the VI Department of Health to prevent the spread of COVID-19, the coronavirus, by staying at home and practicing social distancing. With so many of us staying at home, especially during the hottest times of the day, residential energy use and cost is on the rise.
Here are some tips the Virgin Islands Energy Office recommends residents follow to help reduce your energy bill. Properly size your AC unit and make sure all windows and doors are closed and sealed sufficiently. Set the AC thermostat between 75 and 78 degrees and utilize natural cooling whenever possible. Prepare multiple meals for the week at once to avoid reoccurring and extended cooking times. Practice outdoor cooking whenever possible. Try to avoid taking long showers. Wash full loads using cold water and air dry clothes whenever possible.
For more information on energy efficiency and how to get the most out of your federal stimulus checks through the VIEO rebate program, call the Virgin Islands Energy Office or visit our Facebook page.
Good afternoon, Virgin Islanders at home and abroad. I hope that you had a restful weekend and a very peaceful Mother's Day. I just want to say a special happy Mother's Day and give some hope to those moms who weren't able to travel to see their children, their grandchildren. I know this is a very difficult time for all of us, but this too shall pass, and one day soon we're going to be back together again. Today we are currently tracking 4 cases of COVID in the territory. So far we have tested 1,215 individuals for COVID-19 in the territory. Of those, 1,110 of those tests came back negative, 69 came back positive, and sadly this past weekend, a 5th individual passed away as a result of complications from COVID-19. The deceased is a 72-year-old male. He's a resident of St. Croix and is the husband of the 4th COVID fatality on the island. This is an incredibly trying time for that family, and our thoughts and prayers continue to go out and be with them. As of this morning, we have 36 tests pending. Particularly tragic for that family who has experienced so much of this deadly virus within their family circle. Like I said, our prayers go out to them. Hopefully the other individual will recover as well as we go through this. But this is an incredibly difficult time, as I've said, for all of us. So we offer our prayers, and we know that they're in good hands at our hospital, where we're doing the utmost to make sure that they are okay. There is one patient hospitalized, that patient at the JFL on a ventilator, and there is one COVID patient at Snyder Regional Medical Center in critical condition, also on a ventilator. As Virgin Islanders, it is deeply within our values to take care of individuals that are in need. Just as when we are in the same position, we have had individuals from all over the globe come to our aid and support. In this particular case, we communicated on Friday that the individual hospitalized at Snyder Regional was aboard a vessel and was in severe respiratory distress and would not have survived a trip back to the U.S. mainland. We could not, as a people, as a government, in good conscience, deny this individual the medical treatment that they were in so desperate need of. It is almost unconscionable to think that anyone could. The decision was not easy because both of our hospitals have scarce resources, but we were confident that at those hospitals we have well-trained medical staff that are trained to receive individuals with infectious diseases, COVID being one of them. Snyder Hospital has the required isolation rooms, ventilators, and the protective equipment. It is said that the true character of a man, or a community in this instance, is tested not when the times are good, but when the times are the hardest. This community has shown over the years, and most recently in the face of this pandemic, that we will always be there and always reach out in aid of our neighbors and visitors in times of crisis. I would like to especially thank our healthcare workers at Snyder Regional, the Department of Health and all the employees that work there, and the U.S. Coast Guard for the outstanding response to this individual in his greatest time of need. We continue to pray for him as well and the other COVID patient hospitalized at JFL to make a full recovery from this. This 2-week period that we're going through right now is a critical time as we closely monitor the impact of the relaxation on the restrictions on businesses and their activities. This weekend alone, our COVID task force shut down several businesses who failed to adequately safeguard their customers and employees against the spread of this deadly, ravishing virus. And I say that to say because I received a number of calls this weekend on businesses being closed down. And I had to share with the people who called and who texted me that this wasn't the first time that we had been to these businesses, nor was it the second time. Some of these businesses we have been to on multiple occasions, warning them to adhere to the restrictions. We have to be vigilant in this, and we have to do things that are sometimes unpopular. But if it's shutting down a business to save one person, then that business is worthwhile to me to shut them down. We understand that it's difficult for businesses to maintain some of the restrictions in their parking lots and their surrounding areas. So we're asking you, the public, to please respect those businesses and the sanctity of those businesses' restrictions that we have put on them and comply. So if you're going to order food from home or on your cell phone. Do not go into businesses to order food and wait around waiting for that food to come. From time we issued this, takeout was always takeout was always envisioned as something that you would phone in your order, and then we would come, the business would bring that order to your car or have it ready by the time you got there to avoid people being able to communicate, sit around the bar, have drinks. All of that really usurps what the process that we've put in place and leaves room for the virus to be transmitted. I would, however, like to thank the vast majority of Virgin Islanders in the community for their cooperation in abiding by the masking guidelines and the other guidance we've put out this past week. I see you all in your masks. You're getting really fast with them as we do, and appreciate the compliance. This week, good news, we are expecting a shipment, actual case of the antiviral medication called Remdesivir. I knew I wasn't going to get that right. The National Institute of Health and Dr. Anthony Fauci have indicated marked progress with this medication in improving the health outcomes for those who are stricken with the COVID virus. This is a limited supply that will serve our immediate needs, but we have more coming as soon as they ramp up the production on this. I expect U.S. nationwide as well as worldwide. Other good news, to our veterans in the community, the Veteran Affairs Caribbean Healthcare System will begin testing veterans residing in the Virgin Islands for COVID-19 at their clinic locations on St. Croix and on St. Thomas. Testing will be done by appointment, and it will take place 2 days a week for the next 4 weeks, beginning on Monday, May 11, 2020. Any veteran feeling the need to be tested because of having any COVID-19 related symptoms are asked to call the VA Clinical Contact Center at 1-877-741-3400. That's 1-877-741-3400, 3400, for further instructions prior to visiting the VA clinic. I'd also like to tell the public that now we have also been getting our additional testing supplies here in the territory, and now we have the capacity to test up to 4,000 individuals, and that 4,000 tests available, and that number will continue to increase as we move on and we get more supplies in from the CDC and other vendors. On our unemployment benefits, we have, before I move on, I just want to say that although these, if you're experiencing symptoms of any kind, you need to go and call those centers. For people who are not presented with symptoms or have not been in contact with any known COVID patients or been to a hot, what we call a hot zone, you know, you need to be, I know you're concerned about being infected with the COVID, but if you've been away from people, you've been locked in away in your home, you're probably safe. The test will pick up will take up the viral count as it increases. So if you have not been around anybody, you've been doing what we said, you've been locked away, you haven't been close to any contacts with COVID, you should be okay. But if you have been in any one of those situations, don't hesitate. Please call the number that we have locally. If you're a veteran, you can call our number, or you can call the number that was provided to you before. In terms of our unemployment status, at this point we have now received 8,074 unemployment applications, 3,000 paper and 5,000 online applications. So far, 3,616 checks were sent out, totaling some $2.5 million. We continue to process these applications at a feverish pace to get those funds to those of you who have filed. We thank you for your patience in this matter. We know it's not easy, and we're trying to crank these checks out as quickly as possible. I continue to urge businesses, as I do every press conference, and business owners in the territory to take advantage of the Paycheck Protection Plan. We are in round 2 of that plan. And in round 2, 723 businesses have received $52 million in SBA loans. And in round 1, the previous round, 240 Virgin Islands businesses received a total of $62 million in loans. That's a total of 963 small businesses and $144 million in services and revenue. Remember, this is money that's being used to meet payroll, rents, and to pay utilities that would not have otherwise been there for our small businesses. If you look at it the right way, most of this will be considered converted to a grant to these businesses. So that's $144 million in our economy that wasn't there before, that is there because of this. So speaking on payroll and checks, contrary to what has been reported this morning in the article from the Virgin Islands Consortium, stimuli checks are being printed as we speak. We are on schedule, as we had said before, in the beginning to get this out. It's what I said last week in terms of what our promise was to the consumers and to the residents, and we are getting those checks are being printed today. Director Joalie also said so on Thursday evening during an episode of the Press Box on a virtual town hall meeting on Facebook Live. I encourage everyone to, pay attention to the information that we are issuing. The information that you hear here is accurate information in terms of the checks going out. We have from now until December to issue the checks. We're going to issue the checks as quickly as possible because we know you need the cash, and so you should be seeing those checks start to come into your boxes this week. We're going to try to get out at least $8 to $10 million every week until we have distributed all the checks. If you have not filed your 2018 tax return, you're a Social Security recipient, or you don't have enough money to gain enough income to file taxes, simply get a form, put 0 income on there, your Social Security number, your name, any of your dependents, sign it off, and get that to the IRB, either in Sunny Isles or in Red Hook, in St. Thomas, St. John District, and we'll get your check out as quickly as possible too. So contrary to all of this confusion that has been created because of articles being printed without verification to anybody, calling anybody to say, well, is this true, or seeking any clarification, those checks are being printed at finance as we speak, and they will start going out into the mail. The money is already here. It's been here since last week, and we'll get those checks to you. Some people have called me and said, well, you should have, why aren't we using the IRS portal to do a direct deposit? We tried that. The IRS were looking into it. They weren't interested in doing that, so we didn't go that way. What we're trying to do is trying to get the checks to you as quickly as possible. Any further delays are not acceptable. So we're cranking those out to you. Have no fear. Your money's good. You're going to get it. I'd also like to thank the 33rd Legislature and Senate President Noel Francis for quickly processing the extension of the state of emergency. They have been very responsive in this. Thank you very much, Senators. And I would also like to thank several of our private sector partners that have come to our assistance by donating material and equipment in response to the pandemic. First, I'd like to thank VIA, who has contributed a lot of protective equipment, the personal, or PPEs, as we say, to our first responders like the police. I would really like to thank Southland Gaming. They donated infrared thermometers, those no-touch thermometers that you see, so we can quickly take your temperature. They gave them to the Snyder Regional Hospital, Department of Human Services, National Guard, and they even went as far as donating some over there to our good friend Premier Foy in the BVI. I also like to thank my good friend William Bill Perkins of Brisa Max for their generous donation of protective equipment, masks, but especially for 5 ventilators that were given to the Snyder Regional Medical Center. If you also remember, Brisa Max was also the full-page ad in the paper that encouraged people to pay their taxes early in order that we can keep the general fund afloat. I just want to remind everyone to refrain from entering any commercial establishment without facial covering. You don't need to have a mask, but you need to have some type of facial covering that covers your nose and your mouth. Lastly, I want to extend a special plea to all of our employers, for employees on the front lines, whether they're cashiers, bank tellers, what have you. All those employees that work all day long with that mask, I mean, many of them stand up for hours. They all have to wear these masks every single day. Please allow these employees to take hourly breaks and go outside to get fresh air. I want to say that again to all you businesses. You know you have the mandated 2 breaks per day by labor, but you have cashiers and people working in these stores all day long. Give them a 10, 15 minutes hourly, let them go outside, get some fresh air, take off the mask, walk around a little bit, let them catch their body before they go back in and back to work. And just manage your shift like that so we can allow people to get fresh air. into their system. Because none of us were really designed to work with restricted airflow, whether you have a respiratory system or not. These masks create restricted airflow, and they're all types of masks. Some cloth breathes better than other cloth. People are using all kinds of things for facial covering. So it will take a little bit of time for our bodies to adjust to this new system. Rotate the shifts employees a little bit more so that these employees can maintain their safety and get sufficient breaks and some fresh air as much as possible. I'd like to thank all of those employees for your cooperation in advance. So that's all I have for you today. I do have Ms. Rivera to make a special presentation on behalf of the state nurses. So I'll turn it over to her now so she could give you some remarks. Thank you much. Ms. Rivera.
Thank you, Governor. Good afternoon. My name is Yvette Rivera. I am the president of the Virgin Islands State Nurses Association, which includes St. Thomas, St. Croix, St. John. On this special occasion, Nurses Week, May 6 to 12, we have decided to honor a special nurse, one of our own. The Commissioner of Health, first and foremost, she's a registered nurse. I've worked with her for many years. I was her supervisor for a short time. Then she became my supervisor, my chief nursing officer. So we go back many, many years. So the board of directors of the Nurses Association decided that who is more appropriate to present this special award. So on behalf of the board, the president, the board of directors, and the members of the Virgin Islands State Nurses Association, I'm proud to present to our colleague, the Honorable Commissioner of Health, Ms. Justa Tita Encarnacion, a special presentation. So Tita, please come forward.
Ms. Rivera.
Yes.
Thank you very much. I also spoke with Ms. Heiliger this weekend, and I really appreciate the honor. I want to say that there are a lot of people, I think, that's taking care of all of us, and I accept this honor on behalf of all the nurses throughout the territory. We not only are registered professional nurses, including our ARPNs, but also our support staff, our licensed nurses, as well as our support staff, CMAs, PCAs, CNAs. I know that a lot of people are out there doing a lot, and I really appreciate it. I appreciate the support that's been given throughout the territory. I look forward to gaining that support even more as we continue the effort to reduce the risk for COVID-19 and throughout the year, as nursing is a daily effort. We just happen to stand up a little bit more this time in reference to healthcare providers, but I really appreciate the thought, Ms. Rivera, so I thank you so much. And I thank all the other nurses that worked with you.
We have a certificate for her. It says, Lead, Excel, Innovate, Mother's Day Nurse of the Month honoree, Nurses Week and Month 2020 Year of the Nurse. This certificate is awarded to Justa Tita Encarnacion, RN, MBA, HCM, Commissioner of Health, in recognition of your dedication, passion, and unconditional commitment to the Virgin Islands community. And it's signed by me, May 6, 2020. And her picture is there along with our VISNA logo and the logo for Nurse of the Year 2020. That's the motto for this year's Nurse of the Year.
Rivera, and congratulations, Commissioner Encarnacion.
And then we have a wonderful basket of good things. Healthy nurse, healthy nation. So we try to give her healthy stuff in this basket. And one more thing, as a member of the association, she gets this wonderful bag that says Nurse of the Year 2020.
Awesome. That is fantastic. Thank you so much. So she is the Nurse of the Year?
She's the honorary Nurse of the Year, yes, for the territory.
Absolutely.
Honorary.
I'm in good hands then.
Very good hands.
Thank you so much. Congratulations, Commissioner. We got some
Honored,
questions.
thank you. I am honored. Thank you so much.
We got some questions on the line. We'll take those now, Richard. Whenever you're ready. Go ahead.
Good afternoon, Governor.
Hi, Sarah. You always end up first to ask the question. It's like luck of the
I
draw.
wonder why. That's because I'm on the case right now. Good afternoon, Governor.
Good
How are you?
afternoon. Good.
I wanted to find out more, Governor, in reference to the PPP process. Still, people are having some kind of concern in terms of how to go about it. How do we go about the PPP program? Is it something that you just go online, or do you have to go to a designated bank? Because that process still hasn't been so cleared out.
I think you have multiple options in doing that. There is a way that you can register directly through online. If you're not as computer savvy, there are many accountants and accounting firms that are processing applications here in the Virgin Islands. I won't call any of them out, but you can look through your accountant, and you can also get them through the bank. You can go directly to the banks, and they have the forms and information, and you can process it there. So whatever your comfort level in doing, certainly filling it out by yourself online is easiest. I had a conversation with the banks up to last week, and they said it's a very simple process. It's about a 2-page application, some more information, and they get those turned around pretty quickly. I am so impressed. I have never seen a bank loan come through faster than this Triple P plan, because you know, in the Virgin Islands, anybody who's been through some stuff, it takes a minute to get some money. I had my own hesitation when this was first introduced, but the banks are cranking out the checks and getting those payrolls done. So encourage businesses to reach out.
And it is the clear understanding that once it is applied to meet the demands of payroll, rent, things of that magnitude for businesses, then this is converted into a loan where you don't have to pay back to SBA.
Absolutely.
Correct?
Yes, that is correct. And if you're self-employed, you can apply for a loan to pay yourself. So there are a lot of opportunities there.
All right. Well, we appreciate that. Thank you so much for the information.
Thank you. Next question.
Have a great day.
You too. Go ahead.
Hello, good afternoon. Ernest Gilbert, VI Consortium.
Hey, Ernest.
Yes, Gov, how are you? Before we get into it there, I know you just said that the checks will be coming this week on Monday. Are you saying that Joel Lee misspoke on the video when he said checks will start to be delivered next month?
Well, I haven't listened to the video that you're referencing, but I know I said last week that I would cut the checks this week, and the checks are being printed right now.
Okay. Well, obviously he's your director, BIR director, so his words, I thought would have hold some water. I want to ask, you mentioned, of course, the checks are coming this week, but one thing you didn't say, at least starting to come this week, but Director Joel said it would take up to 4 months to make sure that, to get all that $84.7 million out.
It would probably, it's probably going to take longer than that to get all of it out, because you're going to have people who haven't filed their taxes as yet, who got to put in their taxes. But what I think what he meant to convey is that we have until December to issue checks. So if you haven't done your taxes yet for 2018, you have time. It's not going to run out. If you're a Social Security recipient, you have time. If you are on some type of public assistance and you don't file taxes, you have time. So July 15th is when is the new tax day, and all those returns are going to come in as well too. So it would be recommended that people try to put them in before that July 15th date, because then IRB is going to get really hectic again. But every single day they're doing this in addition to all the other work they're doing. So one of the main concerns that we were worried about is the bank's ability to process $60 million worth of checks. I've been contacted by the credit unions who are saying that they can assist in cashing checks or taking deposits into your account at a credit union. We just want this to be done as orderly as possible. There have been people reach out to us and say, why don't you direct deposit? There are a lot of privacy issues connected with the IRS that don't allow us to mix IRS information with regular information. So we're doing the list, we're making sure we don't have the duplicates, and we're issuing the checks out. There's also a requirement by the IRS that we send you a letter with the checks, and you know how our checks are now, they're self-folding. So we have to also go back and make sure that you get all those people who are getting checks get the letters. But we're going to try to do at least $8 to $10 million every week, or what our pay, we feel that our check system can handle.
Okay, Governor. So thank you. And again, your BIR director had said 5 million. They were projecting 5 million a week. Now you're saying about $8 to $10 million a week.
Yeah, our BIR director is very conservative in terms. I always have to push them in terms of what we're going to get out. But we had a conversation. He did say that. We had a conversation with finance and him this morning, and they keep saying, we just won't want the banks to be crowded, but we cranked that up. And we'll monitor the banks, and if it could take more, we'll send out 15, 20 million a week. So the problem is not us getting out the information. The real linchpin is trying to keep everybody safe and relax the frustration in the lines. As I said, most of our banks in the territory, there are check apps that you can just download, take a picture of your check, it goes right into your account. You could put in your check, deposit it with just a deposit slip in an envelope, or you can go to an ATM and deposit that check that way as well. So anybody else, the grocery stores, please give us your assistance in getting these checks cashed out so we can get much needed relief to our residents. Thank you, Ernest.
Last week we'd spoken about the government needing to most likely borrow money to certain that the unemployment insurance fund has enough monies to cover the amount of people who are filing for unemployment claims. You said the government will most likely need to take a large sum of money to be able to maintain the payments to residents. Right. Of course, this might be some time, more folks are being laid off. What is the status? Has the government taken any steps to the process to seek a loan to make sure that folks who are unemployed will continue getting their money?
As a former labor commissioner, I could tell you that the process for getting unemployment loans is it's simply like a click. It's just like it takes 2 minutes. You go on on a portal, and the Commissioner of Labor is authorized by the governor to go on there. You tell it how much money you need for the month, and then you just click send. It asks you for verification. You click it again, that's it, the money goes. So it's not a protracted process or anything. This is something that's kind of like common business practice. We did it a lot during the recession, the last recession, so that's the easiest part of it, getting the money.
My final question, Governor, thank you. And so basically it's kind of like two in one, but we learned that there were a lot of disaster, dating back to 2017, after the storms, that there were millions of dollars waiting to be spent, but FEMA has not yet released those funds because there are missing documents from the administration. And Governor, if you don't mind, this one is for a resident. She called this morning, and she said she had a lot of difficulty from Fredericksburg Healthcare. So she suffers with some respiratory issues. She has asthma, and I remember you stating that, for children 2 years and under, and those who are suffering with respiratory issues are exempt from the mask wearing. Right. Well, she said she's been trying to go to Fredericksburg Healthcare to get a recommendation letter, so that she's able to go and buy, food for children. She was crying on the phone, and she said the response she got was very discouraging. They told her she looked fine when she was really suffering. She actually broke down on the phone crying. So Governor, we understand that the community is concerned. Is there any word you would like to send out to businesses and healthcare facilities that may seek to, refuse those who may be ill respiratory but need help?
Yeah, good thing, Ernest. You could text me her name and her number. I will call her personally and get that straightened out. But I mentioned last week in my Thursday press conference that businesses would please work with people, whether they show their inhaler or their medication, letting them know that they cannot wear a mask or that they should get a doctor's note. I will personally call Ms. Webster down there at Frederickstead Health Center to make sure that they give a little bit of deference to those people who may need a doctor's slip, or give them some, or maybe they can devise some kind of card or something so that it'll be easier to issue on a wide basis to those patients. That is an unfortunate experience for that young lady, but please text me her number and we'll take care of that for her.
Thank you, Governor.
That's it. We don't have any more questions. You know, it's just like people have so many hurdles in this response to this pandemic, is that each one of us try to be a little understanding and try to help out with the things that we are going through. No one has ever seen a pandemic like this before, to this magnitude. Up to this morning, I was talking with a friend about how quickly they were referencing the Spanish flu. But you realize that a virus allegedly started in China was able to affect the entire globe in less than 2-3 months. It just gives us all a little bit of pause on how we deal with things. And as we move forward, you know, I had a talk with my staff this morning, telling them that, you know, we got to figure out how to live with this thing. You know, this is not going away anytime near. I wish I could see the light at the end of the tunnel in terms of getting over this COVID. So rather than do that, we all need to figure out how to adjust our lives, the way we deal and interact with our families and community, the way that we treat people coming to our store, or the way that we just process things that are going on in the community now, and just have a little bit of understanding that this is very, very tenuous, and people are under all kinds of stress. Worried about the economy. I mean, this was stressful living before, now with this on top. And many of you out there listening to CNN and MSNBC and all the other news media, a lot of conflicting things you're learning all the time. You know, take a little time out to have a little patience with yourself and with your surroundings. It's a lot, I know, but try to figure it out.
I want to say the numbers. I know you spoke about calling the numbers, but we didn't repeat the numbers today. And so I think it's important for us to repeat the numbers. If you have any symptoms, if in terms of behavioral health, if you are concerned, there are some hotline numbers out there, and we'll make sure that we get those out to you. But if you have symptoms, I want you to call these numbers again: 340-512-6299, 340-712-6299, or 340-776-1519, 340-776-1519. That's the hotline number, and we'll make sure it's on the DOH website. You'll have all of the behavioral health. If you have an emotional strain, TV2 actually did an excellent expose today in reference to how we are all feeling. We're all affected by this, not one person more than the other. So take care of yourselves and be safe.
So know that as we go through this, you're going to feel the stress of it, but, you know, figure out some outs, do some exercise, get out, take a walk, you know, take a break from the mask. And if you're like me, you know, you don't really like the mask. I know you guys don't like it. I don't like it either. But we have to do it to keep our community safe. So take a little break, go outside, take off the mask, walk around a little bit, walk for lunch instead of sitting at your desk. Do something, get out there in the sunlight. Vitamin D is always good. And relax. Give yourself a break and give everybody else a break. And have a beautiful week. Thank you so much. And stay tuned for the Spanish version of this message.
Buenos días. Hoy estamos rastreando 4 casos de COVID. Hasta ahora, en el territorio, hemos probado 1,215 personas para COVID-19. De esas pruebas, 1,110 dieron negativo, 69 positivos. Lamentablemente, el pasado fin de semana, un 5º individuo falleció como resultado de COVID-19. El fallecido, un hombre de 72 años, residente de Santa Cruz, era el esposo de la cuarta víctima mortal de COVID. Este es un momento increíblemente difícil para esa familia y nosotros y nuestros pensamientos y oraciones están con ellos. A partir de esta mañana tenemos 36 pruebas pendientes. En el Hospital Juan Francisco Luis hay un paciente de COVID-19 hospitalizado en un respirador. En el Centro Médico Regional de Snyder se encuentra un paciente de COVID ventilado en estado crítico. Dentro de nuestros valores profundos como virgen isleños está el cuidado de personas con ciertas necesidades. De igual manera, cuando nos encontramos con las mismas necesidades, hemos tenido individuos en todo el mundo que socorren a nuestro llamado de ayuda y apoyo. El viernes comunicamos que un paciente hospitalizado en el Centro Médico Regional de Snyder se encontraba a bordo de un buque y tenía graves dificultades respiratorias. Este no iba a sobrevivir un viaje de regreso al continente estadounidense. En buena conciencia, no podíamos negarle a esta persona el tratamiento médico que necesitaba desesperadamente. La decisión fue fácil porque ambos hospitales tienen un personal médico bien entrenado que está capacitado para recibir a personas con enfermedades infecciosas. El Hospital Snyder cuenta con las requeridas salas de aislamiento, ventiladores y equipo de personal. Se dice que el verdadero carácter de un hombre o una comunidad, en este caso, se prueba cuando los tiempos son los más difíciles. Esta comunidad ha demostrado a lo largo de los años y más recientemente ante esta pandemia que siempre extenderemos la mano para ayudar a nuestros vecinos y visitantes en tiempos de crisis. Me gustaría agradecer especialmente a nuestros trabajadores en la salud del Centro Médico Regional Snyder, al Departamento de Salud, a la Guardia Costera, por la excelente respuesta a esta situación humanitaria. Oremos por este y el otro paciente de COVID hospitalizado en el Hospital Juan Luis para que tengan una pronta y completa recuperación. Este periodo de 2 semanas es un momento crítico, ya que monitoreamos de cerca el impacto de nuestra relajación en las actividades de negocios. En este fin de semana solamente, nuestro grupo de trabajo COVID cerró varios negocios que no lograron proteger adecuadamente a sus clientes y empleados contra la propagación de este virus. A la gran mayoría de la comunidad me gustaría agradecerles su cooperación en su apoyo a las pautas de mascarillas y por las otras directrices que implementamos la semana pasada. Esperamos recibir esta semana el nuevo medicamento antiviral Remdesivir. El Instituto Nacional de Salud y el Dr. Anthony Fauci han indicado un marcado progreso con este medicamento en la mejora de los pacientes positivos de COVID. Este es un suministro limitado que servirá a nuestra necesidad inmediata. Se recibirá más una vez que se aumente la producción de esta. En este momento hemos recibido 8.074 solicitudes de desempleo, 3.000 solicitudes en papel y 5.074 solicitudes en línea. Se enviaron 3.616 cheques por un total de más de $2.5 millones. Seguimos procesando estas solicitudes a un ritmo febril para conseguir fondos para aquellos de ustedes que han sometido sus solicitudes. Gracias por su paciencia en este asunto. Sigo instando a los propietarios de negocios en el territorio a aprovechar el programa de protección de cheques de pago. En la segunda ronda de financiamiento apropiada por el Congreso, 913 empresas en el territorio han sido aprobadas por más de 61.4 millones de dólares en préstamos. En la segunda ronda, 723 empresas de las Islas Vírgenes recibieron 52 millones en préstamos SBA. En la primera ronda, 240 empresas de las Islas Vírgenes recibieron un total de 62.2 millones en préstamos SBA. Esto es un total de 963 pequeñas empresas y 1.044.2 millones en total. Este es el dinero que se utiliza para cumplir con la nómina, alquileres y servicios públicos de pago que de otra manera no habría estado disponible para nuestras pequeñas empresas. Contrario a lo informado esta mañana en el artículo del Consortium de las Islas Vírgenes, los cheques de estímulo se están imprimiendo actualmente y están programados para ser distribuidos esta semana. Eso es lo que dije la semana pasada y eso es lo que el director Joel Lee también dijo el jueves por la noche durante un episodio de Press Box que sirve como nuestro town hall virtual en Facebook en vivo. Quiero dar las gracias a la 33ª legislatura por aprobar la prórroga del estado de emergencia. También me gustaría dar las gracias a varios de nuestros socios del sector privado que han acudido para asistirnos donando material y equipo en respuesta a la pandemia. Vaya, que ha contribuido con equipo de protección personal, los PPE, a nuestros socorristas como lo son la policía. Southline Gaming donó termómetros infrarrojos a muchas agencias, incluyendo al Hospital Snyder, al Departamento de Servicio Humano, la Guardia Nacional e incluso hasta las Islas Vírgenes Británicas. Gracias a William Bell Perkins de Grisa Max por su generosa donación de PPEs y de 5 ventiladores al Hospital Snyder. Solo quiero recordarles a todos que se abstengan de entrar en cualquier establecimiento comercial sin cubierta facial o mascarilla. Por último, quiero hacer un llamado especial a todos nuestros empleadores e empresarios. Por favor, permita que sus empleados tomen descansos cada hora y salgan afuera para tomar un poco de aire fresco, especialmente para aquellos empleados en primera línea como cajeros y cajeros bancarios, por nombrar algunos, que ahora deben usar estas mascarillas durante todo el día, muchos de ellos de pie durante largas horas. Nosotros no fuimos diseñados para trabajar con flujo de aire restringido que es creado por las mascarillas y tomará algún tiempo para que los cuerpos, nuestros cuerpos, se ajusten. Por favor, gire los turnos un poco más para que estos empleados puedan mantener su seguridad y obtener suficientes descanso y un poco de aire fresco tanto como sea posible. Le agradezco de antemano su cooperación. Gracias y que Dios les bendiga.